At Arcwood Financial and Arcwood Benefits Consulting, Arcwood HR, as collectively as you all know us as Arcwood. We are independent organizations and companies. We specifically do not offer legal or tax advice. Our goal is to provide you information so that you can make decisions that are appropriate for you and your firms, which is why we have individuals like Matt and Dennis on the line. Because we like to reserve the legal and the tax work up to those professionals. And now I would like to transition over to Diana Durham. There are a number of updates that she would like to share with you from an HR perspective. And how are you today, Diana?
I'm good. I'm a little overwhelmed by all of that information, but it was
It's a lot.
It's a lot, and it's, you know, while this says, you know, goodbye 2020, hello 2021, as you said before, we are in the 13th month of 2020, so we're not really have completely said goodbye to it.
While we got back in town, it's like one of the first articles I saw, what was it, January 9th, you know, about another airline that went down. It's just like, are you kidding? It's like we just can't escape it.
We're not out of the woods completely yet. But I am looking forward versus backwards and hoping that we can hopefully get through all of this in the next 6 months, maybe.
Right. Let's talk about new updates.
So new laws. So every year there are hundreds of laws usually passed on both the federal level and the state level, changing things, adding things, all the nuances that happen with laws. This year there were fewer new laws and regulations that we have to be paying attention to because of this little thing called COVID. States were not passing as many laws and regulations other than the state of California, which I think had 30 new state laws come through and effective on 1/1. So, but for minimum wages, there were 26 states that had updates to their minimum wages starting in January of this year. In Arizona, our minimum wage went up to $12.15 an hour as of 1/1. So if you have employees that are making less than that, you need to give them a bump up to at least that amount. Flagstaff is the only city in Arizona that has something different than the state, and theirs shall always be $2 more, at least $2 more than what the state minimum wage is. So their current minimum wage is $15 an hour. So
are they capping off at 15, or are they always going to be $2 more?
The way their law is written, it's always $2 more, at least $2 more than what the state is. So once the state gets above a certain amount, then theirs will change as well.
Okay.
And then several states, 6 states had changes to leave laws. Colorado, Maine, and New York added paid sick leave. So just like here in Arizona, they now have people earn 1 per every 30 or 40 hours worked sick time available to use in their states, and those all became effective on 1/1. In Connecticut, they are starting a paid family and medical leave. In Connecticut in 2021, the payroll deductions start in 2021, and then employees will be eligible to start asking and using their benefits in 2022, so that they take a year to build the fund up with payroll deductions before they can start taking the time off. And in Massachusetts, last year in 2020, the payroll deductions should have been taken, and employees are now eligible to start using their leave and asking for that time off in Massachusetts. And then California did an expansion of their paid family rights leave, lowering the number of employees needed to be eligible. I think it's now 6 employees. So any company that's got 6 or more employees.
So they're just lowering the
threshold.
employer eligibility. They're not
Correct.
changing the actual. Okay.
Correct.
And do these updates, do they have to be documented in handbooks and things in that
Yes,
nature?
they do. So employer posters need to be changed. If you've got, your handbooks may need to be updated depending on which states you're in.
And this is where the employees reside.
Yes.
Not where I'm operating as an entity, just to make sure we're clear.
Not necessarily.
Okay.
California laws are a little different on some of that stuff, but in these, it's if you've got employees and you're running your business in Colorado, then you now have to provide them with paid sick leave, for example.
Okay.
But at least we're not in Portland, Oregon, where they have now put facial recognition technology restrictions. That was one of the new unique laws that went out there.
Really?
Yes. And in Montgomery City, Maryland, there's now a law that says there has to be at least a 30-hour work week for janitorial services.
Clearly, they have a strong lobby.
Yeah.
Do you see any of those things coming towards Arizona?
Not at this point, but you never know. We'll see.
Yeah.
The governor is actually supposed to be doing his state of the state here in a few minutes. 20 minutes or so, 10 minutes or so. So it'll be interesting to see what he wants to try to.
He's got what, 2 years left and
and then we have a new governor. So we'll see what happens. Some additional new laws specific to Arizona. We have our hands-free Arizona. There have been cities that have had hands-free laws in place, but now it is statewide. So all drivers must have hands-free mode ability. They should, if a cop sees you on your phone, holding your phone, they can pull you over just for that. They don't have to have another reason now. And the fines can go from $75 up to $250 for that.
And now the big one.
And now the big one. So recreational marijuana. The state is still working through the application process and all of that stuff. So people aren't going to be able to buy their first purchases until March or April of this year. They're working through the application process.
Are you listening to that, Matt? You have March and April.
So you have a little while still before you're allowed to buy and have it.
Just because it's legal doesn't mean that some of the people that wrote this weren't partaking in it, right?
Fair.
True. Okay. But the smoking in public places and open spaces, that's still banned. So you're still not allowed to, light up anywhere you want to, even once this becomes readily available. But the big part of this for employers is that the Act does not restrict the rights of employers to maintain a drug-free workplace or to have workplace policies restricting marijuana use by employees or applicants. It does not require employers to allow or accommodate the use, the consumption, possession, transfer, display, transportation, sale, or cultivation of marijuana in the workplace. And it does not restrict an employer's right to prohibit or regulate conduct occurring on their property, which is otherwise legalized by the Act. So what this means is that you need to make sure, if you don't have a drug and alcohol policy, you better make sure you have a drug and alcohol policy that is a complete and thorough policy that outlines what you're testing for, what the process is for testing, who looks at the tests, the confidentiality of that, the reasons why you're testing, because we will be watching in this, and there is one case that's going through right now for the safety sensitive positions and trying to determine what is actually going to happen with that piece of it. So there may be adjustments to what this means for employers as this comes through and as this continues. But as of right now, you can still say you can't be, just as you can't be drunk, you can't be high when you're at work. And you can still discipline your employees if they show up drunk or high. But you also want to provide in your policies and in this process, EAP information, substance abuse policy, policies and how procedures of what happens if someone comes to you and says, hey, I have a problem, and helping them manage through that process and not retaliating against them if they're coming to you for something like that.
Does this have any reconciliation with the prescription for medical marijuana?
So with medical marijuana, typically what happens is if you're testing for someone and they have a medical card, that the lab that is doing the tests for you are reaching out to those people if they test positive to confirm those types of things. They haven't completely told us how that's all going to work yet with this, but if they don't have a card, they show positive for this, you may still be able to terminate them. And Dennis might be able to provide us with, if he's on, with a legal kind of thought process on this a little bit. But my understanding is the medical marijuana card, just as if someone is on it, has a disability and they're on an opiate for their disability, for their injury or whatever, and they take a drug test, they may still pass a drug test even though they've tested positive for that based off the lab results.
Okay.
But we'll be continuing to watch that. Ffcra extension. So when they did the PPP and all of that stuff, they did extend in the CAA Ffcra leave, but it is now optional. Employers aren't required to continue to provide it, but they can if they so choose. And if they do choose, they'll still receive the tax credit that's been available on the Ffcra leave until the end of March. But employees don't get a new bank. So if they already used their 80 hours of sick leave, or they've used the 12 weeks of paid time to care for a child that's out of school, they don't get a new bank to start off 2021 with. So it's really, this is only for those employees that may still have time that they haven't used, or they haven't been out sick at all. And then they end up getting sick now.
So it's really just an extension. Instead of having it expire at 12/31, it's just now being pushed out to March 31st.
Correct.
It's really just, but the provisions haven't changed. The reasons
Nothing
for
has
using it haven't
changed.
changed. Okay. And those are still taking care of someone that's in, well, I'm positive, taking care of someone who's positive. My kids are not in school.
Correct.
There's a fourth one I thought too. Am I
So
missing
it's
one?
basically if I've been told to quarantine, or if I've got a positive test, if I'm taking care of someone that's been quarantined or positive, or if or if my kids can't go to school or daycare because they've been closed and there's no one else available to take care of them.
Okay.
And now the
vaccines.
So can we make vaccines mandatory? Maybe. We don't know. There is no, some of the things that we have to look at and think about when trying to make that determination is disability accommodations. So if someone has extreme allergic reactions to items, they may not want to or be able to take the vaccine because of the issues that they're finding with those that have severe allergies. If I have a religious belief against vaccines or medical care, then I may have to give an accommodation and not make it mandatory for them. There may be worker comp claim potential issues that will come up if you're making it mandatory and someone gets the vaccine, or you're doing the vaccines in your facility and someone does get sick or has a reaction or an adverse reaction, then they could have a potential workers' comp claim to manage through with the vaccine. But there may be some industries, clearly healthcare, first responders, frontline workers, that may be allowed to make it industry, that it's an industry requirement to have it mandatory. But we really have to look at, with all of this, is it something that really makes sense for the industry you're in? A grocery store may make it mandatory, but a retail store may not, or an admin office may not be allowed to make it mandatory, but a hospital will. So there's not a lot of guidance yet. The EEOC has provided some guidance, but again, it's a little maybe-ish language. So it's really hard to say at this point, and there are no court cases yet to tell us how the courts are going to tell us what they are going to say yes or no to. And some states are already looking at laws specific with the vaccine to prevent employee discrimination. So I can't not hire somebody just because they have or have not gotten the vaccine and such. So there are some states that are already looking at laws to prevent you from making it mandatory, in certain situations. So this is one of those very fluid areas that we're going to be watching a lot of over the next couple of months as vaccines continue to become available, but they're moving at a much slower pace than they thought they were going to with the vaccines.
Yeah, I think you said they're projected to get out to the general population in 5 years at its current rate.
Yes. And they're finding that at some places that the vaccines are already starting to expire because they're not using them fast enough. So we're going to have to really see what's going to happen with this and continue to keep our eye on what's going on. But here in Arizona, the Group 1Bs opened up today. Beyond healthcare workers, teachers can now get the vaccine, first responders, police and fire, and then those that are over age 75 and older can now get into the line. But it's taking, if you go today into the system, the first eligible appointments were 3 weeks out. So it's still a huge backlog
process.
Yeah.
Okay. And I know I was reading, just kind of continuing the conversation just on the virus itself, is Medicare is changing their reimbursements for the testing. So I know it's not on the vaccine side, this is on the testing side, but it's still applicable for employers. Is where the reimbursement was $100 for the labs. And I guess now they're changing it to, it's a reimbursement of $75. However, if the lab results and the test results are out and completed within 48 hours, then I understand it's going back up to $100. So clearly they're, starting the incentive from Director Vima on making sure that the testing turnaround is going to be much faster. So.
Well, that's been the hard part, especially for employers, that, you have someone that's out sick. You don't want them to come back until they've been tested and they're out for 2 weeks waiting for a test result, even though they may have been negative and it was just a cold, or a flu or something, but people are trying to be super cautious and wanting their employees to get tested before they come back. And so it's that fine line we're all walking right now on that.
So hopefully those tests speed up.
Yes. And then last but not least, I just wanted to, because as the new year and in HR, in benefits, your world is always busy in November, December. In HR, my world is really busy in January, because there's lots of things to be thinking about the first of the year in 2021 and making sure that we've got everything done. So these are just a couple of things for everyone to start thinking about, and we'll be discussing these more and more as we continue these town halls. But ACAs, the 1095s are due to employees by March 2nd. That date was extended from January 31st out to March 2nd again this year. But the IRS filing didn't change. That still has to happen at the end of March. So if you have 50 or more employees, or you have a self-funded medical insurance, you'll need to be working on getting these filed and taken care of. 401k testing happens in January. So if you've got a 401k, you'll be hearing from your administrators on that soon, I'm sure. Employee handbooks, first of the year is always a great time to look at this. We all jumped in with telecommuting and remote work in 2020 without really having any standard rules and policies around it. So this is the time, if you haven't done it already, to look to add those types of policies to your handbooks, as well as reviewing.
And your substance policies too.
Yep, substance abuse policy. And this is just the time, sick and leave policies. It's that time of year to kind of look and see, are you following any of the laws that may have changed and are now effective 1/1, which then goes to our workplace posters. Also need to make sure that those are updated. Arizona, you're going to have to update your minimum wage notice for your workplace posters. So looking at that.
And how do those posters work for telecommuting? It's still the same requirements?
You're still required to have them available and around for your to your employees. So if they're not in an actual building, then you've got to find some way to make sure that the posters are being submitted and out there and available to your employees, whether it's in a benefit portal like we have Ease, or an intranet service that you use, a payroll service that can put those posters somewhere where an employee could see them if they would want to. Okay. Performance reviews, typically those start happening in January, February, first quarters. So you've got to think about how that will be done this year remotely. How are you going to meet with employees? What does 2020 look like for merit increases? What are you going to do if business hasn't been as busy? How are you going to manage that process to keep people still engaged and wanting to work? And then continuing to look at your return to work procedures. So I think we said this a lot last year, but communicate. Make sure you're staying in front of your employees, talking about what you're doing. If you're still working remotely, what does that continue to look like? Are you thinking about bringing people back into your office at some point once they have been vaccinated, or once things maybe settle down a little bit more, or as more people have the vaccine available to them? Continue to talk about mental health resources and our EAPs that we have available. And it's cold and flu season. So while we haven't heard a lot in the news and such about cold and flu season, we do know that people are catching colds. They do have the flu. It's not just all COVID related sickness. So making sure that we are continuing to keep our employees and everyone healthy and safe during this time. And then you've got the CMS reporting for the self-insured as well.
Yeah, that's right. I figured I'd sneak that one in there on you, just because there's, kind of going back to the Medicare notices that are required that everybody sees inside the benefits portal. We have to show that to the employees so that they know what the responsibilities on Part D. as far as being credible and non-credible coverage from the group plan. Employers, we also have to report through the CMS portal to make sure that Medicare understands who's primary is really effectively what they're doing. Is they're managing the coordination of benefits. I know we have notices that go out. I don't know when it's scheduled to go out, honestly. My first week back coming in after the holidays was my reentry was a little bit more turbulent than I had anticipated. But I know Jessica is working on that with her team, and that distribution is probably going out if it already hasn't gone out. But I figured there was a little bit of a white space there, so I thought that I would actually just kind of
toss it in there. But yeah, there's lots going on. So
going back to your return to work question is, so if I'm hearing you on the vaccinations, requiring the vaccinations, it's kind of a wishy-washy, probably hedging closer to not requiring vaccinations at this point, just because there's some unknowns. So therefore, is my return to work, can that be predicated based upon a vaccination? So if I'm going to be bringing folks back into my office, can I draw a line there and say, but the folks that are eligible to come into the office again, they have to be vaccinated? Or is that still in that, and not saying that you have to force them to get vaccinated because they can continue to telecommute, but can you have a definition like that as well?
Potentially, and that's what the EEOC has kind of outlined their stuff, is that, you make it as a recommendation, not a requirement, and that if people are still able to telecommute, then they continue to telecommute, and that only those that have gotten the vaccine are allowed to actually come inside your buildings and kind of work through that process there. So yeah, that's just part of all of trying to figure out how to make this all make sense. But like you said, it's 5 years down the road before you and I are going to be eligible for the vaccine. So I think
I did hear a report that Biden was going to be opening up the stock on January 20th. I don't know.
Right, so we'll see.
It came out of.
But the problem is, it's not even so much the stock, I think, with the vaccine at this point. It's because hospitals and medical facilities are so overwhelmed with patients that there aren't people available to give the vaccine. So it's a slower process than what they probably hoped it would be, just because there aren't enough people to give the vaccine out. So they're doing fewer vaccines a day. They're hoping to look at ways of finding different places that, having pharmacists and other places do vaccines and opening up the location available to do them. But that's part of the problem. It's not so much the stock, is that it's the capacity and distribution of it within the states.
Because it's still through the designated spots, right?
Correct.
I mean, we're not going to, and then if I remember correctly, that's on Maricopa.gov's website. I think it's Maricopa.gov/coronavirus.
Right.
And that outlines the different, I guess,
Yeah, and each county has their own
delivery system.
Their own delivery system. So each county website is where you would go to look for your specific information if you're outside of Maricopa County.
Okay.